Taking a look now at some COVID-19 related items here on the town hall. There are quite a few things that we're following here. Health officials are saying a new COVID variant has been detected. In addition, we're seeing some promising news on the vaccine front, with Moderna coming out today and saying their vaccine is effective in younger children in smaller doses. And then there's always concern about whether or not mask mandates could return. So joining us now on the town hall is Chief of Infectious Diseases at UB, Dr. Thomas Russo. Dr. Russo, I'll jump right in with that new variant. Governor Hochul said that health officials in the state have detected BA.2. What can you tell us about this one?
Okay, let's start with some nomenclature. So the Omicron subvariant that caused that holiday peak and large number of cases has been termed BA.1. But another subvariant that, think of it as a cousin of BA.1, called BA.2, has been causing an increasing proportion of cases around the world, including this country. Now, we know a little bit about BA.2, and the reason it's causing an increasing proportion of cases, it seems to be about 30 and perhaps as much as 50% more infectious than BA.1. However, there's also some good news. It doesn't cause any more severe or less severe disease than BA.1, so similar level of severity. And importantly, our vaccines are going to hold up to BA.2 in a similar fashion as they hold up to BA.1, which means that if you're vaccinated and boosted, extraordinarily protective against severe disease, hospitalization, and bad outcomes. And in addition, if you suffered infection during that Omicron wave, which began around mid-December here through the holidays with BA.1, that's going to afford significant protection against BA.2 as well. Unfortunately, we still have COVID in the area, and with the increased number of activities, it wouldn't be surprising if we have a bump of cases with this more infectious variant going around, and BA.1 in itself is pretty infectious as well. And so people need to be careful, and those that really are at increased risk, that really need to avoid high-risk activities, are the unvaccinated, if you're immunocompromised, if you're eligible but yet to receive your booster, particularly if you're 50 and older, pregnant, or a significant underlying disease, or lastly, if you live with any of these three groups in the same household. Obviously, you don't want to bring the virus into the house with these individuals that are at higher risk.
Good to get some perspective there. We want to move on to the promising vaccine news today, with Moderna saying that they're seeing positive results with children 6 months old and under 2. And that was a group that has still been pretty vulnerable because a vaccine hasn't been widely available for them. What should parents know about this new information today?
Well, this is great news. To be clear, Kate, it is a press release, and so we'd all like to see the primary data on this. But assuming it holds up, the response in the children with the Moderna vaccine at a 25 microgram dose, a quarter of what adults receive, generates an immunologic response that's very similar to what we saw in adults. So that's great news and would be predicted to be highly protective. And importantly, the safety signal looks great as well. No serious adverse reactions were noted. So I know that this is a group that's been hit hard because they haven't been eligible for vaccination. Parents have been anxiously waiting for this vaccine. Hopefully it'll go through the regulatory process quickly. The data will hold up, and we'll finally get this last group on board.
Yeah, some promising news there. You know, we're also hearing more about COVID patients being able to take home therapy drugs like Pfizer and Merck's capsules. And health systems are rushing out same-day prescription deliveries, even testing and treating patients on the same day. What are some of the challenges with treatments like this, especially with some people hesitant to get tested, thinking, oh, it's just a cold?
The secret with any antiviral treatment, including these new treatments for COVID, is to start the treatment as soon as possible. And the early symptoms of COVID could be very minor, just a little bit of a scratchy throat, a runny nose, maybe a little bit of a headache. The key is, if you're an individual that's at high risk developing more severe disease, which this medication is really designed to do, it decreases severe disease by 80%. You develop any symptoms at all that suggest that you may have COVID, please get tested as soon as possible, because if you're positive, you want to reach out to your healthcare provider get their prescription and start that treatment as soon as possible to maximize the benefit.
Yeah, and it's going along with what you said earlier, which is COVID is still around. And, we just crossed a milestone, the CDC saying that 80 million people have tested positive since tracking began 2 years ago. We have this new variant. And while the numbers are relatively low right now, how realistic is it to see a possible return to mask mandates, especially here in New York?
I think on the short term, that's unlikely. I think we're at this stage where mask usage is going to be really relegated to the individual to use their best judgment. We already talked about some of the higher risk groups that should be using masks because COVID is still around, and particularly when in the indoor setting, when not everyone is wearing masks, that's when the virus spreads particularly well. I think, and let's hope this doesn't happen, if another variant evolves, and we haven't seen this yet, and I hope we don't, but if one evolves that could evade the immunity wall that we've built up, which has now become fairly significant, and we start to see a large increase in cases like we saw with the initial Omicron wave, that may be the time when we would start to reconsider mask mandates. But I just don't see that on the short term at this point, Kate.
We always appreciate being able to get this context and perspective behind the headlines. Dr. Russo, thanks as always for joining us.
Yeah, great to be with you as always.